Welcome to the deep dive. Really excited about today. We're going to properly sink our teeth into something critical in the horse world. We've got this stack of source material right here, information you've sent in, and our mission really is to pull out the most important nuggets about equine acute colitis. Specifically, we're kind of zeroing in on two big bacterial culprits mentioned in these sources, Salmonella and Clostridium infections. So we'll get clear on the problem, how these bugs work, what to look for, the signs, how vets figure it out, and then treatment and prevention.
Yeah, and it sounds maybe like just a gut problem. But what these sources make incredibly clear is that acute colitis is, well, it's much more than that. It's a sudden, systemic, often life-threatening condition in horses. And the material you've given us, it really lays out the complexities quite well.
Okay, let's unpack this then. Based on the info we have, what exactly is equine acute colitis?
Fundamentally, it's a sudden, really severe inflammation of the large intestine. So that's the colon and the cecum.
And the classic sign, the one everyone thinks of.
Profuse diarrhea, yeah.
Yeah.
Often explosive. But, and this is key from the sources, it's not just messy. It signals a much deeper, dangerous issue. It leads to, profound systemic illness, severe dehydration, and this condition called endotoxemia, which is absolutely central to understanding how bad this can get. It's potentially fatal. Needs immediate, aggressive vet care. No question.
Right. So the material highlights these two bacteria, Salmonella and Clostridium. Let's tackle Salmonella first. What do we need to know from your sources?
Okay, Salmonella. They're gram-negative bacteria. The sources mention Salmonella enterica, specifically a type called S. typhimurium, as common in horses. What's really interesting and a bit tricky is that horses can actually carry Salmonella without showing any signs.
Yeah.
It can be asymptomatic carrier.
Silent carriers.
Exactly. And then something, tips the balance, stress, maybe transport, getting a high dose of the bacteria, and boom, they get acutely sick.
Got it. Okay, now Clostridium. How are these different according to the sources?
Clostridium species are different critters, yeah.
Yeah.
They're gram-positive, they thrive without oxygen anaerobic, and they form these really tough spores, spores that can survive in the environment for ages. C. difficile and C. perfringens are the main ones linked to colitis here. And the crucial point the sources make is that these guys are often normal gut residents.
Normal. So how do they cause disease?
It usually happens after the normal gut balance, the microbiome, gets disrupted. That allows them to overgrow. A classic trigger mentioned. Recent antibiotic use.
Ah, okay. That makes sense. Now, this is where it gets really fascinating and, honestly, a bit frightening. How do they actually cause all this damage? What's the mechanism?
The absolute core issue, whether it's Salmonella or Clostridium causing it, is a breakdown of that gut lining, the intestinal mucosal barrier.
Like the wall protecting the inside?
Precisely. Think of it like that protective wall getting seriously breached. For Salmonella, they actually invade the gut cells. They get inside and produce toxins, causing inflammation and direct damage. But the really devastating part, that comes from endotoxin.
Endotoxin, okay.
Yeah, it's also called LPS, lipopolysaccharide. It's part of the salmonella cell wall. When the bacteria die, they release it. And because that gut barrier is broken, this LPS floods into the horse's bloodstream. Endotoxin then triggers this massive, body-wide inflammatory response. We call it SIRS, Systemic Inflammatory Response Syndrome. It's like the body's defense system goes into overdrive, but in a destructive way.
So it's the horse's own massive reaction that's doing a lot of the damage systemically.
Exactly. That systemic inflammation causes chaos.
Yeah.
Blood vessels dilate, blood pressure drops, organs don't get enough blood, the heart muscle can struggle, clotting goes wrong, leading to things like DIC, which is often fatal. And crucially, it's a major trigger for laminitis.
Laminitis, right. Always a huge concern.
Huge. Plus, that damaged gut leaks protein like a sieve, which adds to the horse's collapse. Now, with Clostridium, their main weapon is producing powerful toxins directly in the gut. Think toxin A and toxin B from C. difficile, or various nasty ones from C. perfringens. These toxins poison and kill the intestinal cells directly. They massively increase gut permeability, causing that huge fluid loss and the diarrhea. And just like with Salmonella, these toxins, plus the general gut breakdown, also contribute to endotoxemia and that whole systemic crisis.
Yeah.
The sources specifically flag C. perfringens type C as being linked to really severe, rapid disease, particularly in foals.
Wow. So it's like a double whammy direct damage to the gut by the bugs or the toxins, and then this overwhelming systemic reaction to endotoxin spilling out.
That's pretty much the essence of how it causes such trouble. Yeah.
Okay, given how severe this is, what puts a horse more at risk? Your material listed several factors.
Yeah, major one, especially thinking about Clostridium, is recent antibiotic therapy.
Right, you mentioned that.
Because antibiotics can wipe out the good gut bacteria, right? That removes the competition, letting Clostridia overgrow and pump out toxins. The sources even specifically mentioned erythromycin used in mares, sometimes being linked to see difficile problems in their foals.
Interesting detail. What else?
Other things are generally stressors. Hospitalization itself, especially if they're already sick, exposure to other horses carrying the bacteria, transport, surgery, sudden diet changes, anything that weakens their immune system or general health. Oh, and high stocking densities, lots of horses close together, that increases risk too.
Makes sense. So what does this actually look like? If you're looking at a sick horse, what are those red flags for acute colitis?
Well, as we said, the most obvious sign is that sudden, profuse, watery diarrhea. It can be really foul-smelling, sometimes even bloody. But you might also see milder forms, maybe just soft manure, like cow pies, especially early on.
So it's not always explosive diarrhea.
Not always. But the key is the combination with signs of systemic illness. That's what really defines acute colitis. Fever is common. Abdominal pain, colic that can range from just mild discomfort to really severe pain. And then you look for those signs of endotoxemia we talked about.
Right, the systemic signs.
Yeah. A high heart rate that just stays high. Rapid, shallow breathing. Changes in their gum color, often bright red, maybe with that purplish, toxic line just above the teeth. Also, if you press on the gums, the color takes ages to come back. That's prolonged capillary refill time. And they'll just look awful, lethargic, depressed, no appetite.
And dehydration.
Oh, definitely. Severe dehydration, sunken eyes, skin that stays tended when you pinch it. And because of that protein loss from the gut, you might see swelling, edema under the belly or in the lower legs. That ventral edema is pretty classic for some cases, especially Salmonella, according to the sources.
So diarrhea plus the systemic signs, that's the emergency signal.
Absolutely. That combination means call the vet immediately. Don't wait.
Okay, vet's called. How do they figure out which bug it is, or if it even is one of these bugs? What do the sources say about diagnosis?
Well, the starting point is always the clinical signs and the horse's history. Thinking about those risk factors, recent antibiotics, travel, stress, then blood tests. They're vital for checking the horse's overall status, hydration, electrolytes, kidney function, white blood cells. Often you'll see a really low white count, maybe with immature cells pushed out of left shift. That shows the body struggling. And almost always, very low blood protein, especially albumin, because it's leaking out the gut. But blood work alone doesn't pinpoint the specific bacteria.
So you need fecal tests.
Exactly. For a definitive diagnosis of Salmonella or Clostridium, you need fecal tests. But here's where the sources highlight a really key practical difference.
Okay.
For Salmonella, the goal is to find the bacteria itself. Fecal culture is reliable, but the catch is horses often shed Salmonella intermittently.
Meaning not constantly.
Right. They might not have detectable bacteria in every manure sample, so you often need multiple samples over a few days. The recommendation is usually 3 to 5 serial samples. PCR tests for Salmonella DNA are faster and more sensitive, but again, because of that intermittent shedding, serial sampling is still often the best bet.
Okay, so multiple shots needed for Salmonella. What about Clostridium?
For Clostridium, it's different. Just finding the bacteria in the manure often isn't enough, because remember, they can be normal inhabitants. The key is detecting the toxins they produce.
Ah, the actual weapon.
Exactly. So vets test for specific toxins, like toxin A and B for C. difficile, or various toxins from C. perfringens. They use tests like ELISA or PCR for the toxin genes. Finding genes for certain toxins like beta-2 or CPE from C. perfringens, or identifying type C itself, is highly suggestive because those aren't usually found in healthy horses.
That's a fascinating difference. For Salmonella, find the bug. For Clostridium, find what the bug does, the toxins.
Precisely. It totally changes how you approach the testing. And the sources remind us you can sometimes have both infections at once, so testing might need to be broad.
Right. So let's say the diagnosis is confirmed. Acute colitis, likely Salmonella or Clostridium. What's the plan? How do you fight back based on this info?
The material is absolutely clear on this.
Yeah.
The cornerstone, the foundation of treatment, is aggressive, supportive care.
Supportive care?
Yes, it's all about keeping the horse alive, stable, supported, while their body deals with the infection and the toxins. Doesn't matter which specific bug it is initially, fluid therapy is paramount. These horses are losing fluids, electrolytes, protein incredibly fast. They need massive amounts of IV fluids.
Huge volumes, right?
Huge volumes. To replace losses, fight shock, correct electrolyte, and acid-base problems. Plasma transfusions are often vital too. They replace lost protein, especially albumin, and provide clotting factors to help prevent things like DIC. Managing that endotoxemia is also top priority. Drugs like Flunix and Meglumin are common anti-inflammatory, anti-endotoxic. They use it carefully in dehydrated horses. There are other things too, like polymyxin B to bind endotoxin, but it has risks. Or oral adsorbents like biosponge to try and soak up toxins in the gut.
Okay, massive support.
Yeah.
But what about antibiotics? If it's bacteria, don't you just hit it with antibiotics?
This is where the sources bring up a really critical and sometimes surprising point. For the primary gut infection itself, systemic antibiotics are generally considered controversial.
Controversial.
Yes, and often not recommended, especially for Salmonella.
Really? Why is that?
Well, because using broad-spectrum antibiotics can actually backfire. They kill off the good gut bacteria too, disrupting the microbiome even more. That can actually promote the growth of toxin-producing Clostridium, making things worse or causing a secondary problem. For Salmonella specifically, antibiotics might also prolong how long the horse sheds the bacteria, and it definitely contributes to antibiotic resistance issues.
So antibiotics aren't always the answer here.
Not for the gut infection itself, generally. They are needed if there's strong suspicion the bacteria have escaped the gut into the bloodstream septicemia, or in very young foals, or immunocompromised horses. If you strongly suspect Clostridium is the main driver, an antibiotic like metronidazole might be used because it targets those anaerobic bacteria without causing quite as much broad disruption. But it's selective use.
Okay, that's a crucial nuance. So mainly support, fluids, plasma, managing endotoxemia. What else?
Other supportive things include careful nutritional management, often withholding food initially, then slow reintroduction, pain relief, gut protectants like sucralfate maybe, and probiotics might be used to try and help restore the gut flora, though the sources note their effectiveness can be variable.
And you mentioned laminitis earlier as a huge risk.
Yes, a devastating complication driven by that endotoxemia. The sources highlight continuous icing of the feet cryotherapy as an important preventative strategy vets are using now.
And biosecurity must be intense.
Absolutely vital. Strict isolation of the sick horse. Dedicated equipment, buckets, forks, everything. Rigorous hygiene for everyone handling the horse. And critically, the sources mention alcohol gels don't kill Clostridial spores. You need thorough hand washing with soap and water or specific disinfectants. Plus, remember, both Salmonella and C. difficile can potentially infect humans. They're zoonotic, so that hygiene is doubly important.
Wow. Okay, so after all that aggressive care, what's the general outlook? The prognosis for a horse with acute colitis?
It's always guarded. Highly variable. It really depends on so many factors. How severe is it? Which bug is it? We saw C. perfringens, type C, in foals mentioned as particularly bad. How quickly did treatment start? The horse's age, immune status, and really critically, did complications like laminitis or DIC develop? Survival rates can vary a lot, but severe cases, they face a really tough battle.
Which makes prevention sound incredibly important.
Absolutely essential. Prevention is all about minimizing exposure and those risk factors we talked about. Strict biosecurity on farms, minimizing stress where you can, being really careful and judicious with antibiotic use only when necessary, making diet changes slowly, gradually, quarantining new horses, all key strategies mentioned in the material. There was a mention of a Potomac horse fever vaccine, which can help with that specific cause of colitis, but currently no widely recommended vaccines for C. perfringens in horses based on the evidence. And of course, good deworming protocols help prevent parasitic colitis, which can sometimes look similar.
Right. Wow. Okay, that was a really thorough deep dive into such a serious issue, all based on the information you provided. It really drives home that this is way more than just diarrhea. It's a systemic crisis.
It really does. It powerfully shows how vital that prompt, aggressive veterinary support is. Focusing heavily on supporting the horse's whole system, the fluids, the shock, the endotoxemia, not just trying to kill the bug in the gut. And it underscores that incredibly delicate balance of the horse's gut microbiome and how things like stress and medications can throw it completely off kilter.
So stepping back, what's the big picture takeaway here?
Well, if we connect all these dots from the sources, it leads to, I think, an important question for you to consider.
Yeah.
Given how tricky diagnosis can be, sorting out which bug when, and given the risks of antibiotics, How might future efforts, maybe research or just general management, focus even more on supporting the horse's own gut defenses and overall resilience before things go wrong, sort of shifting focus towards prevention and strengthening the horse's system rather than just reacting once this devastating disease takes hold?
That's definitely something to mull over. Thanks for joining us for this deep dive.